Well, hello. First, I want to thank the North Carolina Integrative Medical Society team for inviting me to speak at this NCIMS summer event. I'm excited and looking forward to it. I am Dr. Ben Gonzalez, and I am lucky enough to not only speak twice, but to have my second discussion be on my birthday. And to be clear, I like chocolate, red roses, and airplanes. So if you can't afford roses or airplanes, then chocolate will do just fine. So I will be speaking on a subject I am very passionate about, women's health and how it is ignored in our current healthcare system. I'll be speaking on gender bias in medicine. And I consider myself a medical feminist. And this is an important subject because many of you have been trained to ignore women and not really be aware of it. Even you OB and GYN physicians, this is a tough subject to truly believe because much of the history of medical care and training does not just border on the ridiculous, but is in your face ridiculous. Studies on medications meant only for women done mostly on men. And I'm not talking about studies done in the 1950s, 60s, or even 90s. Rather, studies done over the last decade. I will show you how studies looking at the number one cause of female mortality have been done mostly on men and how this affects the outcomes of the health of your female populations. I am passionate about this because my mom, morbidly obese most of her adult life, who had gone through a gastric bypass in the 1970s when we were doing only about 5,000 to 6,000 cases a year, and now well over 300 cases a year, survived it. Lost a lot of weight, gained most of it back, and the following decades was medically treated like a man and tortured in a system that starved her, placed her on drugs and diets and improper diets and drugs that nearly killed her. My wife, my amazing, highly active, vegetarian, pescatarian, in great shape business owner wife, had her first heart attack at the age of 38 despite having 4 medical specialists managing her prior to the heart attack. I didn't know her at the time, but I'd met her 4 years later, and I'm going to go over her story and how it directly relates to your practice. In our current healthcare system, honestly, our current healthcare system believes that women are done with life at the age of 52. I'll explain why, and that's not a made-up number, but a real thing out of the history and literature in medicine. In my second lecture, I will introduce a transition in medical care of the LGBTQ and genderless and non-binary communities. It is important that all groups within this patient population have access to appropriate, timely, and quality health care. We acknowledge that many trans and non-binary patients have had negative experience of accessing healthcare in the past and continue to do so. I'm going to introduce first steps in providing a supportive service to this population. So, my mom, my sisters, daughters, grandchildren, all deserve good care specific to who they are as women, all our female patients. The thousands of female LGBT and gender non-specific patients have taught me a lot over the years, and I would like to pass on some of that experience to you. I will introduce the ICD-11 term, gender incongruence. This is a tough subject. I certainly do not have all the answers, but I feel I do have a responsibility to all our current and future patients that fall into these neglected categories. I kind of want you to come out of these lectures a little upset at a system that sets medical providers up for failure, and worse, sets up your patients for perpetual neglect. But I also want you to come out of these lectures with a better understanding of how to move forward with an awareness that allows for positive change. I mean, like I said earlier, I am a true medical feminist, and I hope what I have to say at this conference will help your practice. I am excited about these discussions, and I'm excited to listen to all the other presenters as well. So looking forward to seeing you in June.